Good morning to one and all present here. Myself, Steffi Rosbabu, along with my group mate Janu Patel and Devyani Patel, going to present the topic Regulated Health Profession Fact Finders. Firstly, we are moving on to the topic Profession Specific Act for the nursing profession and the dietitian profession. For the nursing profession, it is Nursing Act 1991, and for the dietitian profession, it is Dietetics Act 1991. Moving on to the next topic, it's regarding the legal title. For the nursing profession, it is registered nurse, registered practical nurse, nurse practitioners. And for the dietitian, it is registered dietitians. The level of education for entry to practice. For the nursing profession, it is Bachelor of Science in Nursing, BSN, and Diploma in Practical Nursing Program. And for the dietitian, it is Nutrition and Food Program, which is BASC, and Bachelor of Science in Human Nutrition Sciences. Then for the professional course, it is Professional Master's Diploma in Dietetics Program, DMPIP. The regulatory college for the nursing profession is College of Nurses of Ontario, and for the dietitian, it is College of Dietitians of Ontario. And the website link is given below, so you can check for the references. The mission for the Regulatory College of the nursing profession is to promote the safe nursing practice to protect the people's health, and for the dietitian is to protect and maintain the public interest. The following topic is the commitment to the public. For the nursing profession, it is the provision of goods and services to the people with disabilities in a similar manner to the general public. And for the dietetics, it is to provide safe, competent, and ethical dietetic service to the public.
Now moving forward to the topic of scope of practice for the nursing profession as well as for the dietitian. So first of all, I will talk for the nursing profession. So promote health and treat the health conditions by providing therapeutic, palliative, preventive, supportive, as well as rehabilitative methods to maintain the optimal function of health. Whereas we talk about dietitian, so dietitian have the scope of practice related assessment of nutrition and nutritional conditions, as well as provide treatment and prevention of health nutrition related disorders by dietary management. Secondly, we are going to talk about authorized control acts and restrictions. There are some conditions and limitations imposed on his or her certificate of registration to perform the following procedure. Performing a prescribed procedures below the dermis or the mucous membrane. Second one, administering a substance by injections or inhalation. Third one, putting an instrument's hand or finger beyond the external ear canal, nasal passage, larynx, opening of urethra, labia majora, anal valve, and into an artificial opening into the body. Other than that, dispensing a drug. When we are talking about the dietitian, so dietitians also have some restrictions to perform some kind of procedures. For example, dietitian cannot perform diagnostic procedures, administrations of the injections of the or the medicines, casting of a fractured bone, psychological therapy, medication prescriptions, and the management of the labor. Now we talk about some interesting facts related to nursing profession and dietitian which we got from this website. Even the unregulated care provider can perform the care, such as wound care, if the nurse delegate the work to them. For example, if nurse delegate the work to PSW, she can also perform the work. To maintain the safety of the clients from the undisciplined nurses, the College of Nurses of Ontario provides tools and resources to identify it. To illustrate, if the client is suffering from sexual harassment, so in this case, the College of Nurses of Ontario can provide resources to identify it. According to the College of Dietitians of Ontario, the dietitians who discontinue their service need to sign a voluntary undertaking for quality assurance if they want to continue their practice. The second fact is the election of the registered dietitians happens every year to become a council member.
Hello, myself Devyani Patel, and from here I will tell you about the collaborative relationship between nurse and dietitian, which benefits the client and nurse. So, the dietitians and nurses are working together in a variety of settings like hospitals, clinics, long term care facilities, or even in an academic settings. Since the nurses are the first team member of the healthcare team who gathers the patient's health history, they can give information about nutrition status to the dietitian. So, first we will discuss the benefits to client. The first one is dietitian plan by using the information given by nurses such as nutritional needs, food allergies, eating habits, and financial status. By using all these factors, dietitian made a plan which is client centered plan. Then second one is they modify and create a new diet plan if the previous plan is not helping the patient to recover by assessing the client supplements level, macronutrients and micronutrients level and preferences of the clients which is different according to their age, such as child have different nutritional needs, young one have different, and as elderly people we discuss benefits to nurses. The first one is they raise awareness by working with registered dietitians, which enables nurses to improve their proficiency in nutritional consultation skills, which helps them to identify and solve the early nutritional disorders to achieve the best possible outcome. Then second, it improves nurses' education. When dietitians participate in the care given of the patient with nurses, they educate the nurses about the facts, type of diet, time of diet, ingredients, the portion of food, nutritional value, and how to identify different nutritional disorders according to the developmental stage of the individual. And third one is help to understand nutrition screening tool. During nutritional assessment, nurses have to collect information such as anthropometric measurements of body composition, biochemical level, micronutrients, and metabolic measurements, as well as social factors that contribute to the client's habits. And this comprehensive information helps nurses to evaluate the nutritional condition by using the different screening tools such as weight, height, body mass index, food intake, waist circumference. Now we will evaluate your knowledge by practicing this question. Then first one is which is the profession specific act for the dietitian? A. Dietetics Act 1991, B. Dietetics Act 1989, C. Dietetics Act 2000, or none of the above. And the second one is which of the following practices dietitians are restricted to perform? A. Psychological therapy, B. Assessment of nutrition, C. Prescription of medication, and D. Both A and B. Thank you.